So I'm currently interested in running lifespan studies. Why? Because SENS has started a program where we want to, repeat lifespan studies that other people have run before, and we want to make sure that whatever was reported is really real. And the other thing what we want to do is we want to combine interventions. So I've been spending a lot of my time recently thinking about like what's the perfect lifespan study, and I know a lot of people here in the room have done similar things. So I wanted to go from like the more specific to like the more broader. So we want to run one with a senolytic. So definitely there's the question of like, what is actually a senescent cells? How can I track that senescent cells in vivo? And I find already the problem in like defining what a senescent cell is and what marker will tell me that this is really a senescent cells, because if I have a senolytic and now I have less senescent cells, kind of how can you quantify it? And I went back to like look to similar people that had problems like this before and how they solved it. And so one example here is the mesenchymal stem cell world. They had a similar problem. What is mesenchymal stem cells, and like what minimal criteria can I apply? So what I would want to see is a similar thing, like the community coming together and saying, okay, what are the minimal criteria to say this is a senescent cell? So that would be one thing. Next, we are not the first to kind of like think about like what's the perfect in vivo kind of intervention. So here's an example from the stroke field. The stroke field already in 1999 came together and they created a community of academics and also companies, because they had a lot of problems. Like there's a quote down here of like, okay, we have like 8 models of focal ischemia, 15 different species, 6 different ways of like how to quantify the infarct size, and then 90 different behavioral tests. So I think we are facing a very similar problem in the lifespan studies. We want to be kind of like having one setup, maybe that people can agree on, because then we are also able to say, my intervention is 10% better than someone else's intervention, and we can kind of compare what is really working and how much better or worse it is. And then there are other problems with the reported lifespan studies that's kind of like, it's not blinded very often, it's not randomized, it's often not very well powered. There is kind of no report on like what the exact housing conditions is. Like everyone that is running in vivo studies knows even the food, even the plastic you're using can have an effect. So we really need to come together and kind of like set some minimal standards and see that we can kind of make them comparable. And then also, how are we reporting it, and how we can work together between academia and collaborations between industry, and kind of come up with like one, hopefully, set of things that we can run. And then in what mouse or other rodent model or other kind of model do you want to run it? So the Alzheimer field already came together and made a pretty good kind of like collection of like their models, and like there's kind of like the models of like Alzheimer and kind of like what features they have, exactly at what month amyloid plaques are turning up, or what kind of like tau is showing up. I would love to see something similar for like, for example, the senescence world, and saying, okay, this mouse model with this and this kind of like time point has X% senescent cells, and kind of like capture that. And then also they are collecting all the information of their biomarkers, and they show here on the bottom really how good and how reproducible that biomarker is. Again, like it would be great to have that centralized place, because I've been searching the web to see if somebody already did it, and the best I could find was like Jackson Lab reporting on aging models, but it's not like there is one central thing. And so these are the easy things where we have already examples of how it's done. And then the ultimate goal is to get rid of lifespan studies, because yes, they are currently maybe the best to see if maximal lifespan can be extended or not with your type of intervention. But who wants to always run a lifespan study? It's 2 years, 3 years of waiting, and then it fails. Yeah, 3 years. So the ultimate goal would be to run studies in parallel and show like whatever your predictive tool you're currently using, your omic of choice, is really showing me like which intervention really works, and show me that it's the exact same thing as when you would run a lifespan study. And then maybe even the other kind of alternative is you're going away from mice, because we all know how bad mice are, and you come up with good humanoid models, kind of like your chip, organ on the chip thing. And the important thing there is the FDA has to be happy with it, because otherwise, like, yes, you can run it, yes, you get some results, but especially if you're in a company and you want to have a product in the end, like, if they don't like it and they don't accept it, then it doesn't really help you a lot. So how do we do this?
Wonderful. Thanks, Alexandra.
So we've been thinking about this a lot, actually, at the Alliance for Longevity Initiatives, because the FDA does need, if they're going to, if we're going to convince them to have a separate track for longevity therapies, we've got to have some kind of biomarkers or some kind of way to prove that an anti-aging therapy is working, right? And so we're planning on asking them to put together a committee of scientists to sort of work on this. And I think they're open to that idea. The thing that I worry about a little bit, and I wonder if you've thought about this at all, is, you know, it'd be really great to have a standardized way to mark progress. But at the same time, there's this worry that when you choose that standardization, sometimes you omit different ways of doing something. So like in the Alzheimer's field, for instance, if you're doing something that has something not to do with plaques and tangles, and you're ostracized, and well, that's not Alzheimer's research. And so the model, do you have any ideas on how to, because the standardization is important, but at the same time, we also have to have some flexibility for out-of-the-box thinking that might bring us to discoveries in that.
I absolutely see your problem, and especially like with the MSc example, like a lot of people then said, okay, you said like now the minimal criteria, and only if they fit, it's an MSc, but I have seen MSc also have other markers, and they don't have your minimal marker, so, but it's still an MSc. Yes, we have to be careful that we are not like stopping research and discovery, but I don't have the perfect answer to that. So it's you could run in parallel like your standard intervention, and then whatever you're proposing of like working better in parallel, and say, okay, this is the standard way, this is doing an alternative. But yeah, I don't have a very good answer to that. It's something that we really do have to have an eye on. And again, the stroke world, they're coming together every year to revisit, like where is the field, what's the progress, and do we need to alter our standards? So we definitely can't
Break that into the,
yes.
when we're creating this kind of task force, it's like, it's not a one and done.
No, it's
this
not.
This is a continual, I like that, that's a good idea.
Yeah.
Wonderful. Thank you, Alexandra. Yeah, I think unfortunately we're out of time for this one. But yeah, I see you're already garnering some interest there for the working group on this.